So tell us how you got into doing men's health. Tell us a little bit about your history of medical school, and then how you got into men's health exclusively, because that's kind of all you do now. Is that correct?
Yeah. So of course, every man who's trying to go from internal medicine into hormone replacement or men's health, um, they try to transition, and their goal is that their entire patient population is going to be that group, but it ends up being a little bit more gradual. And at this point, I would say most of my patients happily are, the type of patients who are coming to me for doing the things that I love doing the most. But I do have a very small group of patients for whom I'm still doing primary care. So I started doing primary care in 2018, and I was doing it on the gay men's community in Orange County. And if you do primary care with the gay men's community, well, you're going to learn HIV care. That's just it just comes with it. And if you learn HIV care, well, then you're going to have to learn about testicular impairment, because a lot of times, if HIV itself didn't impair the testicle, the tenofovir will impair the testicle, which is part of two medicines, one of them given for an HIV positive person and the other one given for an HIV negative person as PrEP. So whether you are HIV positive or negative, if you're a gay man, there's a lot of reasons for you to have testicular impairment. Now, having said that, that population also, in that population, men, there's a different culture. Guys want to look good when they're older. Guys still feel that they got a lot of ammo when they're older. They don't have the same heteronormative, constraints in their relationships and how they look at life. And so everybody wants to be fit and look good and happy until they're 80. That's kind of the attitude. So with that, you kind of pick up hormone replacement as part of what you do for them. Now, I was doing that, and then at some point, I just realized that, wait a second, it's actually impossible for me to do appropriate and safe hormone replacement therapy on these men if I'm having to deal with 10 other medical problems. It's just, I don't have the stamina. There's no time. Right. So then I thought to myself, okay, well, there's a reason why people specialize in that. That's the reason. And then I did a lot of research to look around me on who is actually doing this so that maybe I can go work for them. That's what I thought. But then I would see all these what I call TRT mills. That's what I call them. So a TRT mill basically is a place you go. There's a huge waiting room. They have a large volume of patients of all ages, generally on the older side. You go there, you get your shot. Sometimes it's once every 2 weeks. Sometimes it's once a week. And then you leave. Generally, there's a physician assistant or a nurse practitioner who's doing it, supervised by some doctor somewhere, either there or not even present physically. And so I said, well, I kind of don't want this, because I was trying to develop the kind of practice where I would be a patient. And the kind of practice where I would like to be a patient is, I don't want you to give me very little testosterone because that's what they tell you on uptodate.com. I want you to give me the testosterone that gives me the best results without side effects such as polycythemia or things like that. Like, I want you to cater it to my body and my tolerance of it. And I don't want you to let my estrogen go up and down. I want the same estrogen I had before being on testosterone. So where is that frequent monitoring? Where is that going to come from? And if my balls shrink, I want you to give me HCG. And if they keep shrinking with the HCG, I want you to give me a higher dose of HCG. Right. And if it's costly, well, I don't care. It's my business. It's my problem. I wouldn't pay the extra. And if the dose is higher than the indicated one for testicular atrophy, but still lower than the max for fertility, okay, I might need the max if it's not working. Who cares? So, and if my B12 and vitamin D is low, well, you got to handle that too, because all of these come together. So this is kind of what I was looking at. And if my hair starts falling, I don't want to go somewhere else to handle it. I want you to have all the options, from oral minoxidil to whatever. So that's kind of the practice that I created. It's something that I would like for myself. And slowly, people are agreeing, and we're getting the type of clients we like.
I love it. So now, where are you located?
So we are in 272 Southwest Birch Street, Suite 200. That's in Newport Beach, California, by all the major highways. So